Welcome back to Lifestyle Matters. I'm your host, Christopher. Have you been in a recent auto accident, have a sore back, or a nagging injury that just won't go away? Well, this is a gentleman you definitely want to know. Dan Barrows, Barrows Education and Training Physical Therapy. Dan, welcome this morning.
Thank you. Morning.
Now, tell us about, let's just say I have that nagging injury or that pain that just won't go away. First, tell us, why should I call you? Why should I contact you? And what are you going to do for me specifically?
Well, sometimes, as you know, when we get injured, either through an accident or an injury from being active in our lifestyle, we get normal muscle soreness, and that's pretty typical. If that begins to persist for more than 2 or 3 days, that may be an injury that could have occurred, and that's when you may want to seek medical attention, either through a physical therapist or your medical doctor.
Okay, so let's say I just have that, not necessarily an injury, but it just won't go away, that clicking feeling when I move my shoulder and I just want to ignore it and maybe take more aspirin, more painkiller, but it's just finally I say, you know what, I've got to call Dan Barrows. Gotcha. How are you going to diagnose that?
Well, we're kind of biomechanist specialists here, so we understand how the body moves, the joints, kind of like an auto mechanic for a car. We know how it's supposed to work and what's supposed to happen with it when we move it and test it. So we'll evaluate the strength, the stability of the joint, the ligament structures, and probably most importantly in these days, the neuromuscular control. Is the brain functioning well with the muscles so that they do what they're supposed to do in sequence? If that's not occurring, you end up with chronicity. You get the chronic pain, you get the chronic popping, the annoyance. I can do some activities, but I can't do it for too long. And when those start to kind of bubble to the surface, that's usually when those become more of an issue and start to curtail your lifestyle. You start to not do the things you enjoy doing in life, and that's definitely when you want to see someone to take care of that for sure.
And I love the fact that you have training and education in the name of your business. Tell us a little bit about that aspect.
Oh, sure. Initially when I had it done, people thought I was a school. So I used to get calls for the first couple months. Are you taking students? It's like, nope, different concept. We believe in educating the individual so that you are responsible for your health. And I'm kind of like your coach. Sometimes you're a medical coach, sometimes just a regular rah-rah coach. But if you want to maintain that healthy lifestyle long term, then you need to be educated in your own body. You need to understand how it works and why it feels the way it feels when you do certain things, and why you shouldn't necessarily panic or be concerned about everything that happens. So part of our process when you come in and see us, we treat your injury, but then we also educate you on that so that you have a better understanding. So when you leave us, you know your body better than anybody else. You understand what it feels like and when it doesn't feel right, when you should seek treatment and when not to.
Well, with that, let's take a look at some of the processes here in your practice.
Okay, great.
And Dan, I'm just looking at basic weights, but tell us how this transitions into what you do.
Oh, sure. Well, with the concept of training and education, one of the things that is super important is being able to make sure that individuals can go home with the same things I'm doing here in my office. So as you scan my office, what you'll see is I don't have a lot of heavier weight equipment, machines. Everything I use is based off a pulley system, which is natural movement of shoulders and knees, and then weights, body weight stuff, mats, rollers, things that are easily duplicated for the patient once they leave our office and go home. So not sophisticated, but highly specialized, I guess is the best way to look at what we do.
So it sounds like a lot of this, what's important is kind of homework assignments, and you train and empower me to do that, and that's an important part of recovery?
Oh, for sure. Yeah, I tell patients, they get to see me 3 hours a week. They've got 169 hours a week at home that they get to do what they need to do. So if I can communicate that to them and understand the importance of it, and that I'm just kind of there to guide them as they go along and make some gains, then we work as a team and their results are much better.
And I noticed like the big blocks on the tables and stuff, is that related to stretching, and how important is stretching?
Yeah, it is. Stretching, depending on the age group, typically younger individuals need more stretching, believe it or not. And as we progress through life and as we get older, we need the strength component. We're no longer carrying children, pushing wheelbarrows. We're not doing as much of that. So strength becomes more of an issue as you get older, believe it or not. So a lot of what we do is a little bit flipped contrary to what you would expect to be done. So a lot more stretching in the younger and a little more strengthening in the older population.
Okay, fantastic. Well, let's take a look at some more stuff that we have that you have available here.
Sure.
Dan, it's great to see what you're doing for the local patients and athletes, which is important to you because you're a local born and bred guy yourself.
Yeah, I am. Born and raised here, second generation, graduate Hoover High School in '81 and then on to Fresno State.
Which is great because you get to work with a lot of the local athletes.
I do. I get to support them through their fundraisers, and then I get a lot of the local high school athletes through here which is really a lot of fun. They add a lot of energy to that clinic, kind of inspire some of my other patients to work hard, and yeah.
It's great. Thank you so much, Dan. And it's great to see you're such a great sponsor for the Morning Great Day show with the Kopi 7th inning stretch. And what does that mean to you?
Well, I just love being part of the community. And Kopi is about as much community as you can get as far as I'm concerned. So just being able to be a part of the community, reaching out and doing my part is a good thing.
Dan, thank you so much. And thank you, viewers, for joining us for another edition of Lifestyle Matters.